My name is Rhonda Mann. I'm the Chief Marketing Officer at Beth Israel Deaconess Medical Center in Boston. We're a teaching hospital of Harvard Medical School and the third largest hospital in Boston itself. The marathon tragedy was something that certainly no one could have predicted. It is one of those events that strikes quickly and very emotionally. It goes right to your gut. It goes right to your heart. And to be a clinician working that day, I can't even imagine. For us on the media relations, communications, and marketing team, we weren't even working that day. It was a holiday in Massachusetts, Patriots' Day to be exact. And so none of the communications folks or any of the non-essential employees in the hospital were in the building that day. At 2:10, basically, at 2:50, p.m. that day, the bombs went off, and 11 minutes later, we received our first patient at our door, as did other hospitals in and around us. Everybody received patients from the marathon. We had 7 critical patients by the end of the day. We also were lucky enough to get both suspect number 1 and suspect number 2 under our care, being the closest hospital to where both of those showdowns with police took place. So within that whole week of the marathon, from the time of the bombings through the week, was an incredibly crazy time. In terms of social media, we learned so many things throughout this event. The first was that we could use our Facebook page and our Twitter site and Twitter feed to let our patients, our patient families, and the public know exactly what was going on at the hospital. In the moments following the bombing, we were shut down to visitors. Just as a precaution, we didn't know really what the cause of that was, and when it first kind of came bubbling up that it could be terrorism, we shut down the hospital to all visitors, and we let people know that through Facebook and Twitter. That, of course, spurred a lot of questions from patients. You know, I have an appointment tomorrow for something really important. Can I come in? My daughter gave birth this weekend. I need to come visit her, that sort of thing. So we tried to keep up as much as we could with giving answers to those questions. Also in the days following the bombing, one thing that we sort of learned was that sometimes you have to sort of take a look at your policies and maybe alter them a little bit as time goes on and as you have different experiences. So we have a non-censorship policy for our Facebook page, for instance. But a few days after we received suspect number 2 into our care, we were clearly the recipients of some type of spam, political spam campaign to free suspect number 2. We've got a ton of postings, and they were coming in so fast we couldn't even read them, let alone respond to them. But you know, saying suspect number 2 was innocent, saying take good care of him, saying can I send him letters? I mean, you name it. We were getting just a complete wall of these posts, and this went on for a couple of days. And we talked to our legal team about altering our policy. Our policy talks about being able to take down certain posts that maybe have bad language or that are attacks on individuals, for instance. But our policy really didn't cover something like this. So we kind of re-looked at it and said, you know what, these posts are not really in the spirit of how we built this Facebook page and why we built it. So we are going to take these posts down and say that all posts have to be relevant to the work we do here at the medical center. These posts were not relevant to that, so we took those down. I would say one final lesson that we learned is that you've got to understand that in today's day and age with digital media, that it is very easy to take a small device and to wander through a hospital and capture images, sound, and without being noticed. It's not like you have that big camera and the camera person with the camera on their shoulder. And so we did catch one member of the media doing an interview in a room that was not okayed by us. We did have incidences where the media did do things that perhaps were not as ethical as we would have liked them to do. By and large, the media was terrific, but we certainly, in a crisis of this size, really had to think about, and have to think about now, and as we continue to think about, how do we make sure that people who have access to certain areas of the medical center don't record things with their phones. We had one staff member offered $5,000 by a member of the media to go in and snap a picture of suspect number 2. And so really kind of keeping track of who's going where and what they have access to, and having that conversation. I know you have a cell phone. Please do not take images or video with that cell phone, because our rules within the hospital are this, and this. I think that's really important. All in all, it was an incredibly tragic event. It is something that I don't think anybody will ever forget who's lived through it. Our communications team worked day and night. They were absolutely tremendous in getting through this, as were our clinicians. And I think we have learned a lot, and hopefully we will be even more ready whenever the next crisis occurs.